ministers the first thing I want to do, Cathaoirleach, is I want to commend the ministers and indeed school staff for the reopening of schools. It's been great to hear young children back at school. My own view, as the ministers will be aware, is that all school children should be back at school at present. I share the view that was expressed in the editorial of the British Medical Journal that was published last week, which says that school closures are not evidence-based and they harm children. I think we need to reflect on what the Children's Ombudsman, Dr Muldoon, said a number of weeks ago when he said we may look back on this period and say it was a time when adults let down children. I want to commend Minister Foley as well in terms of what she stated about the figures yesterday and the recording of the figures being down, but I would urge both ministers to recognise that if we do have an expedited improvement in the figures, let's not be stuck with the date of the 12th of April as being the start for the rest of the children to go back. That's nearly 6 weeks ago. 6 weeks away. We have a huge number of children in secondary schools who want to get back to school. Their parents are contacting me and they're very concerned about their children. They see their children be lethargic, listless around the house, not going out, not engaging, not socialising, and they're missing important developmental stages. Now, I'm aware we have to be conscious of the public health concerns and the public health advice, but we have to be sure that we don't heap a further public health crisis upon our young people as a result of being too cautious when it comes to trying to ensure that the disease is suppressed. So again, I just want to commend the ministers for the work they're doing, and I think it would be great if we could get all children back to school prior to the 12th of April. Thanks, Cathaoirleach.
Deputy Ministers, we have about 30 seconds.
Sorry.
I'd like to go.
Minister. Thank you. Just in terms of the Deputy's point about the return to school, we have had in this instance, obviously, as we have since we've reopened schools from September, abided by the advice of Public Health and NEFIT, and in this instance it is their best advice that it should be a cautious and phased return to school, and that is largely, and I must confirm this again, due to the mobility of such a large number of people, 1.1 million people, and it was for that reason in the first instance that they were stood down, because they have again confirmed that schools in themselves are places of low transmission. With the best will in the world, we would love to have everybody back as quickly as possible. There is a burden of responsibility being placed on all of society now to ensure that we can keep the numbers down, keep the hospitalisation down, and there's very, very positive news in that direction. People have done a tremendous job, and we're just asking people to stick with that now so that we get children back as quickly as we possibly can, and young people in terms of school.